Health Watch is presented by Umass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by Umass Memorial Healthcare. Today's topic is pulmonary hypertension.
The body has two circulations. One is through the lung, and the other one is through the rest of the body. When we take blood pressures, we take systemic blood pressures. Pulmonary hypertension is high blood pressures in the lung vessels. It affects the right side of the heart.
What are the symptoms?
The symptoms are generally shortness of breath, fatigue, weakness, and on occasion the right heart fails and the right heart doesn't contract, and then you get swelling in the abdomen, swelling in the legs, and you have difficulty doing your activities of daily living.
In between the onset of symptoms and diagnosis, there's a good amount of time that passes. So what are the reasons for this?
The vast majority is because there is an intrinsic problem in the small blood vessels of the lung, which takes time to develop. You generally become symptomatic when the blood pressure in the lung reaches a certain level. And just to be clear, there are many causes for pulmonary hypertension. The most common cause is actually that the left heart isn't working well, and it increases the pressure in the lungs. Less commonly are conditions that affect the lung vessels themselves, which may include such conditions as scleroderma, and in young women they develop a condition called idiopathic, meaning we don't really know what the cause of it is, pulmonary hypertension. It's a major source of mortality in young women who actually develop this condition.
How is Umass Memorial Medical Center treating pulmonary hypertension?
We try and identify the cause of it, and then we treat the cause initially, and then we treat the small vessels in the lung by giving them medications that prevent narrowing of the vessels and cause dilatation of the vessels. So these are highly specialized medications. Some of them we give in tablet form, and others we give as a continuous infusion.
Is research being done to improve the quality of life for those who have this disease?
This is a focus of many centers in the country. We work closely with Tufts Medical Center, who has a number of trials that we engage patients with to see which medications work for them. So there's an explosion of research in this area now.
Who's at risk for developing this disease?
Anyone, for example, that has left heart disease may develop pulmonary hypertension, including valve disease. Young women who have a family history of this condition should be aware that this can be transmitted from the parent to the child. Those commonly with a condition called scleroderma, or you may have heard of a condition called CREST, which is limited scleroderma. They are at risk. People with chronic liver disease are at risk, and people who've had multiple blood clots in their legs that break off to the lung can develop this condition because of the small blood clots that go to the lung fields. It increases the resistance in the lungs.